Hi everybody, my name is Neka Obidema. I'm a family nurse practitioner and I'm here to do a presentation on the importance of diet and exercise in African Americans with hypertension. Okay, so in this education plan, I'm gonna have five stakeholders included, and they're gonna be, of course, me, the family nurse practitioner, the medical assistant, the dietitian, and of course, the fitness instructor. Before I start this study, I'm gonna make sure the patient has already signed the consent form. Okay, and the roles each of the stakeholders will be playing will be the nurse practitioner will be more involved in the diagnosing of hypertension with the diagnostic tests and detention, and of course education and follow-up. On the other hand, the medical assistant will accurately measure and monitor the African Americans blood pressure while they're in the clinic. They will provide patient education as well to the patient, and the dietitian role in this will be to provide the patient with a good meal plan on how to control blood pressure, and the fitness instructor's role will be more like guiding the patient on the right exercise to do to help with reduction of high blood pressure. Okay, so now the next topic we're going to talk about is a theoretical foundation and conceptual framework. So, the use of the health belief model theory will guide every step of patient education in controlling high blood pressure. According to this theory, four critical areas determine the patient's perception and health related behavior. They include: one, we have the severity of the illness, we have the susceptibility to the condition, preventive action benefits, and barrier to preventing illness, according to Mohammed and Easton 20 et al. 2022. To start with, perceived susceptibility will facilitate the teaching of African American that genetic associations with their race highly predispose them to hypertension. About perceived severity, the concept will guide the stakeholder in educating patients in the effect high blood pressure has on body organs, especially the heart, that are life-threatening. Perceived benefits concept will guide stakeholders in identifying what African American patients with hypertension believe will facilitate the control of their condition. Three factors are to be put under consideration, which are the medication, exercise, and diet. But in this study, we're going to be focusing more, in this plan rather, we're going to be focusing more on the diet and exercise as the measure of objective. Okay. Lastly, the concept of patient barrier related to action taken is to be analyzed. Availability of dietitian and fitness instructor will ensure those patients with hypertension lacking adequate knowledge on diet and exercise are fully educated and know what to do. Okay, so the next so another thing I would like to talk about is, beside the application of conflictual framework within the research study, will facilitate different roles of stakeholders and content to be taught on African patients with hypertension. All the four aspects of contractual framework are put under consideration, and they include the patient, the nurse practitioner, the medical assistant, the dietitian, and of course the fitness instructor. Okay, we're also going to include the environment, which is going to be the clinic area, and the health, which is the hypertension among African American, nursing, which is teaching about the diet and exercise. Guided by the nursing computer framework, the person of high interest is African American patient with hypertension, as suggested by Major et al. 2019. Nursing education by other stakeholders is to take place within the clinical area, and web-based platform is ensuring the patient adequately apply diet and exercise in their quest to control their blood pressure. Okay, so the next topic we're going to be talking about in this plan is education needs for the patient. So each group of stakeholders have a specified education needed in relation to African Americans with hypertension. To start with, the African American patient needs to be taught about the importance of actively participating in the study. The major aim of this study and plan is to identify the benefit exercising and diet has on controlling hypertension. Therefore, the patient needs to be aware about faithfully participating in the exercise and nutrition plan to be formulated while undertaking the research study. Also, the nurse practitioner needs to have the knowledge of screening and identifying African American with hypertension. So, according to the American Heart Association, hypertension entails blood pressure reading that is consistent of anything greater than 130 for systolic and greater than 80 for diastolic. Patient needs to be on immediate drug therapy or stage 1 hypertension. A list of African American with hypertension is to be drafted by the nurse practitioner upon presenting a consent form to be signed by patient. Also, the medical assistant needs to be knowledgeable about screening of hypertensive patients. African Americans are the only hypertensive ethnic group to be actively enrolled in this plan. Accurately measuring their blood pressure during the clinic visit to be done by the excuse me will be done by the medical assistant. Okay. Right. So the next we're gonna talk about the dietitian. Okay. So the dietitian should be knowledgeable about the diet which lowers blood pressure. A major eating plan best known to control hypertension is a dietary approach to stop hypertension, which is a DASH diet. The diet is rich in vegetable, fruits, whole grains, and of course low fat. And this diet is very good and best in lowering blood pressure, as suggested by Kurakasel et al. 2018. Foods to be avoided by hypertensive patients since they increase the blood pressure are salty recipes, caffeinated drinks. We have the coffees. We all like our coffees, but if we have a patient that is hypertensive, we always have to encourage them, to quit coffee or minimize coffee intake. Besides, the fitness instructor needs to be knowledgeable about the type of exercise and blood pressure reading under which exercise should be avoided. So we know that if a patient has a systolic blood pressure of anything more than 200, they shouldn't be exercising. They require to stop exercising and contact the family nurse practitioner or their physician. Heavy lifting exercises within short period of time does increase blood pressure. So the dietitian, of course, will always tell the patient not to do that. So the fitness instructor will pretty much educate the patient about the exercises to do, like the working, the jogging, the swimming. Just something little, not anything intensive. Even if it's like 5 to 7 times in a week, those can be a good way to exercise to help decrease blood pressure. And in African American also, so the fitness instructor will have to have that knowledge to be able to educate the patient. Okay, and the next one we're going to be talking about the intervention delivery plan. Okay, so African American with hypertension. African American hypertensive patients, high blood pressure control teaching plan are to be delivered face to face through the use of pamphlets or a web-based resource. In every clinic visit, the nurse practitioner is to be consulted by the hypertensive patient. It is at this occasion that patient will be guided on high blood pressure education involving a healthy diet and exercise. Since the nurse practitioner will be the lead coordinator of the process, patient will be given internet link for accessing a web-based teaching. Diet plan related to the hypertensive stage of the patient are to be printed in pamphlets made available during clinic visit. The dietitian is to provide patient-centered approach to enable the patient in cohort chosen from the diet and exercise to attain their objectives, okay, which is lowering blood pressure as suggested by Fortier in 2019. About exercising, the fitness instructor is to display physical skills to be applied in various aerobic exercise required by hypertensive patient. In order to enable easier access of the skill to this patient, pamphlets are to be printed guiding the patient on various aerobic exercise, timing, and quantity to be applied. So generally, the use of web-based resource will be the essential for patients who use technology and An advancement has been widely accepted in the United States. Lesson plan and online handouts will be made available for patients. The nurse practitioner together with the stakeholders, the medical assistant, the dietitian, and the fitness instructor, are to record short video clips with hypertension teaching in their free time. Patient through the provided internet link are to access the web-based resource and enjoy high blood pressure control teaching. A large number of the teaching will be useful to African Americans with hypertension. The research will carry out on diet and exercise. A daily goal through video watching is a motivation for adequate exercise and adherence to the suggested dietary plan. Feedback collection is to be done by the medical assistants from patients during clinic visit concerning their progress in exercise and diet plan. Any challenges and achievements are to be channeled to the nurse practitioner, dietitian, or fitness instructor for immediate intervention. So this is the plan I'll have and for my patients with hypertension, and by the end of 3 months I will call them back and check the results, and there should be improvement in their blood pressure. Thank you, and this is the end of my presentation. If you have any questions, please do not hesitate to reach out to me and your questions will be answered. Thank you so much and have a great day.